Hi there. Thank you for joining me today as we continue our conversation on your doctor and COVID. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Today, as you see, I'm wearing my mask, and of course, the correct way to wear your mask is to make sure that it's covering both your nose and your mouth. It's not resting under the nose, nor is it resting under the chin. I'm alone today, so I will take my mask off so we could have a more personal conversation, and you could read my lips if you can. So we're going to look at a topic today that is actually quite important as one of the first for our achievements in Guyana. And specifically, we're going to talk about convalescent plasma. I'm going to take you through the steps of determining what exactly is convalescent plasma, why do we use it, what we're hoping to achieve, and all of the things that we need in order to, from collection to utilization. And it stems from a question, well, so much as a comment or a request from a viewer just like yourself. And remember, if you have any questions, you may WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. So here is the request. Please explain the use of convalescent plasma. And this is actually a source of pride for us at the Georgetown Public Hospital Corporation, because we were among the first in the entire Caribbean to utilize this therapy as an option in treating admitted patients who are COVID-19 positive and who actually were sick at the time of their admission. So let us examine what really is plasma. If you take a sample of blood and you put it in a test tube, the technicians in the various laboratories will do a process of centrifugation. They will spin that blood. And if you spin it and you allow it to settle, it will settle in its components, because blood is not a single product, but it's made up of several components that come together to serve the various purposes that we enjoy or we benefit from having blood. Now, at the bottom, the heavier particles, which are the cells of the blood, will settle. And at the top, that is where the plasma will settle. And that plasma is what contains antibodies or soldiers or defense mechanisms to fight against infection. So what really is convalescent plasma therapy? So by definition, it is really the transfer or the passive transfer of antibodies to a sick person to treat a disease. So let me explain a little bit what are antibodies. Antibodies are essentially your own defense mechanism that you produce to fight off infections. So if you are exposed to a virus or a bacteria or some infected material or an infectious source, your body will naturally try to fight off this infection. And one of the ways in which it does so is to produce antibodies, and these are your soldiers. And you can imagine these are floating soldiers that are going to be blocking any invading particle or infectious particle from attacking your body's cells. So they're there circulating, and when you are exposed and there is an invading bacteria or virus in your system, these antibodies essentially block them from attacking your cells. So that is the basic concept for this. We take these antibodies from blood of a recovered patient and we transfer that into a sick patient. And we do so by taking that top part of the blood after it's been centrifuged and allowed to settle. It appears kind of yellowish or straw colored. And that is what we take and we process and we transfuse it, just like a normal blood transfusion, into a sick person, hoping that the antibodies in that portion of the blood is strong enough and can offer help to the sick patient. The aim is to actually neutralize the virus should it enter the body, or if it's already present, it helps to fight off, okay? So to understand the processing of blood, we have to talk about a concept or a definition of something called apheresis. Now, apheresis, by definition, is an area of study that deals with the processing of blood outside the human body to cure or treat a disease. Now, use of plasma has been around for a long time as a therapeutic option since the time of the Spanish flu in the early 1900s. So this is not a new therapy. And when we were faced with COVID-19 pandemic in the world, several places started using convalescent plasma to fight off this infection. And Guyana was among the first in the Caribbean to employ this strategy. And we were able to show that it can be safely done in terms of collection, processing, transfusion, and we have had encouraging results in our patients who would have received convalescent plasma. So apheresis is studying the blood outside of the human body. You take it from the person, the donor, you process it, and then you obtain the various blood components that you would need to transfuse or give to a recipient. These can include the plasma, stem cells, or other products that are contained within the blood. So the process that is actually involved in this is quite simple. All the donors must have been confirmed to have had COVID-19 and recovered. So you would run your PCR test on them after they're recovered and make sure that they are no longer positive. They would have had to have no symptoms for about 14 days minimum. Persons between the ages of 18 to 60 are suitable donors. We do not take donation from too young persons or too old. The plasma is collected just like any blood product and stored within the blood bank. This entire process, or apheresis, it takes about an hour to an hour and a half. That's 60 to 90 minutes. And we collect, well, you always hear about donating a pint of blood, but for accuracy, it's between 200 to 600 cc's of plasma, which are collected from each patient. The donors, after they give the blood, they are monitored for about 15 minutes minimum after the collection to make sure people are not too dizzy, they're not fainting, they don't have any side effects from giving blood. Some people have very bad reaction just at the sight of blood, especially at the sight of their own blood. And the entire process actually happens by informed consent. So the overall mechanism on the study is quite simple. A viral infection will lead to antibody production. Any person who comes in contact with viruses will mount a response. So when that person mounts their response, they're recovered, we then collect that blood or that plasma from them, and we transfuse it into a new person who is sick. The COVID-19 patient, of course, must have been without symptoms for at least 14 days after testing negative. So they would have had the infection, they test negative, and then a further 14 days without symptoms. So that recovered patient will donate their plasma, which has the antibodies in it, and a compatible recipient who has the same blood type and blood group, etc., will then receive it. The antibodies in the convalescent plasma will then block the connection of virus to the cells of the recipient, and therefore reducing the number of infected cells in this person. There are other components within convalescent plasma that can actually be useful as well, but for the purposes of this discussion, we look at the benefits of the actual antibodies. So the convalescent plasma therapy, that entire process starts with the collection from a donor. After the collection, then this is tested to ensure that the donor's plasma is free from all kinds of potential contaminants and infected sources that can then be transfused into the recipient. And that's a very strict and stringent process that occurs. And all blood banks and around the world, and I can speak for ours, this is a very highly technical area, and the people who do this process are experts in their field, and they are actually quite good at what they do. The plasma is then frozen as soon as possible to minus 20 degrees Celsius. And some of it is actually collected to be stored for use or testing at later date, because we may not have all the answers right away, and we may not have all the tests that we want to do right away. So we are keeping it in cold storage, sometimes as low as minus 80 degrees, so that it can remain there for a long time, and when we actually need to test it, we can actually test it and find out valuable information. This frozen plasma, when needed and required for patients, it is then requested from the blood bank, and the blood bank will then supply it, and it's transported in a frozen form to the hospital that has requested it. And then there's something called a blood warmer, usually, that they allow it to come back to normal temperature so that it can be safely transfused from a frozen state into a normal temperature state and then into the human recipient. So that's a very simple explanation of a very complex process, which is carried out by highly trained and dedicated professionals. Recently, there has been some new evidence or research that has come to light, and early indications were indicative of benefits using the convalescent plasma, and there's a host of other research that is ongoing. But one of the big ones that came out did show some results which were a little bit unexpected, which suggested that in moderately ill COVID-19 patients, moderately ill means that their oxygen saturation is less than 95%, that in these patients, convalescent plasma did not seem to reduce death. However, it did reduce the number of positive patients at day 7, There are multiple ongoing trials that will verify and provide new information. But what we have learned is that it may be better to use convalescent plasma in the early stages of this disease rather than waiting until moderate to severely ill state. And we may also have a role for convalescent plasma in prevention in those who are high risk, for example, healthcare workers. So I hope we would have had a better understanding of the whole science of convalescent plasma, when we use it, why we use it, how we use it, and what we hope to achieve. So thank you very much for joining us. Remember, if you have questions, you can WhatsApp to 620-6275 or send an email to docandcovid@gmail.com. Thank you.